Good morning.
Good morning, Heidi. Good morning, Heidi.
Good morning.
Morning, Councillor Van Passen.
Morning, Chris.
Morning.
And I'm not even behind schedule today yet. So.
So has anybody heard from Councillor Taylor or Councillor Patterson?
I'm just admitting Councillor Taylor right now, Mr. Chair.
Okay, thank you.
Councillor Patterson just accepted my invite to the meeting, so he's
Okay.
certainly aware.
Okay. Heidi, we can actually start the meeting because we have a quorum.
Okay.
So I'm going to suggest we start the meeting. It's 9:33. Are there any disclosures of interest? Okay, are there any additions to the agenda? None. We have a motion to adopt the advisory committee meeting minutes of March 15th. Can I have a mover? Councillor Corbett, and a seconder? Councillor Taylor. All those in favor of that motion? Is carried unanimously. Are there any updates from the March 15th meeting?
Yes, thank you, Mr. Chair. The childcare report was approved by Norfolk Council. The report on Delgold Villa was approved by Counseling Committee last Tuesday and will hopefully be ratified by Council tomorrow night.
Okay, great. Thank you. So we'll move into staff reports and we'll go right to public health, a verbal update regards to COVID-19.
Thank you, Mr. Chair. I will be giving that report this morning. So we currently have 280 active cases of COVID-19. We're up 22 new cases from yesterday. We've had 257 new cases over the past 2 weeks. And so that's a daily rolling average of 24 new cases per day. The highest we've seen in new cases per day in the last week or so has been up to 35. High rates of the variants of concern, particularly the UK variant. We have outbreaks on farms, either workers testing positive when they arrive or at the second interval of testing on day 10 of their isolation. We have an outbreak at a long-term care home, an outbreak at a group home, and outbreaks at 2 workplaces in Haldimand and Norfolk. On the vaccine front, we have administered almost 31,000 vaccines, and we have vaccine clinics happening at Norfolk General Hospital, the 2 mass immunization clinics at the Cayuga Arena and the Delhi Arena. The community paramedicine program, our programs are doing mobile clinics, and then we have 18 doctors' offices and 3 pharmacies that are participating in the vaccine rollout. As committee is aware, we are currently under a more restrictive stay-at-home order due to the increasing cases of COVID-19 in the province. It is certainly a very concerning situation right now with the rates of cases going up and the rates of hospitalization. So we are hopeful that the stay-at-home order and the additional restrictions will assist the situation, but we cannot stress enough how important it is right now for people to follow the public health guidance, which is to stay at home unless you have to go out for essential reasons, to limit your contacts to those who are in your household, to wash your hands, to wear a mask, and to get a vaccine as soon as you're eligible. So with that, Mr. Chair, I would be happy to answer any questions.
Thank you, Heidi. Councillor Corbett, you have a question?
Yes, I did. I had several of them, and you can answer them when they come up. How are we doing in recruitment for a new medical officer of health?
So, Mr. Chair, through you to Councillor Corbett, we have had a posting. That posting just recently closed and we're reviewing the applications. We have also been having discussions with a number of physicians in the area. And so we're still working aggressively towards having a new medical officer of health by the time Dr. Nassari is finished May 22nd.
Thank you. I know we've experienced a lot of problems with the rollout of appointments for vaccinations. Where are we now in terms of that?
Mr. Chair, through to Councillor Corbett, when our online booking system went live, The system it was overloaded with people logging on, and so it crashed and it was down for 2 days. It's been upgraded with a larger server. That's my non-IT description of how it's been fixed. It is operating, and I assure committee that we did not have any vacancies in our clinics as a result of the online system being down. We have had full clinics, and we continue to have full clinics. We're booking clinics 2 weeks at a time right now. So some people are indicating that when they go on the system, they can't get an appointment. That's because we only post 2 weeks worth of clinics at a time, because that's how we get the vaccine allocations. We only know how much vaccine we have 2 weeks at a time. So we don't want people booking appointments a month, 6 weeks out, and then not have any vaccine. So we update the online system with new clinics and new appointments as soon as we know what our vaccine allocation is.
Thank you. I'm scheduled to get a vaccination tomorrow, and there's an indication that we've been shortchanged through the province for some of the vaccines. Is that the case? Are you definitely getting the vaccine?
So, Mr. Chair, through you to Councillor Corbett, we have vaccine available for our clinics for the next couple of weeks. Our Pfizer allocation, it started out at 2 trays, and then we were up to 4 trays per week. We're back down to 2 trays now. We do need, we are reaching out to the province and having conversations with the province about the fact that at 2 trays per week, as people become eligible for their second shots, we will have an inadequate supply of vaccine. But we have enough vaccine for the clinics that are currently booked.
I've heard positive comments at vaccination stations, how they're doing. I'm pleased to hear that.
Thank you, Councillor Corbett.
And the other question, I know that Hauser's Pharmacy in Dunville is giving AstraZeneca or Veneca, whatever it's called, vaccinations. And I know there are people who are coming in from outside our community. How does that augur for keeping track of how many have been done in the county?
So, Mr. Chair, through you to Councillor Corbett, the pharmacy vaccination program is connected directly to the province. It doesn't come through the health unit. So the pharmacies receive their allocation directly from the province, and people book their appointments directly with the pharmacy. So the number of vaccinations that have been given at the pharmacies are over and above the 31,000 that we have given in our clinics and through our community paramedicine program. Because it is a provincial allocation and a provincial program, it is my understanding that people are able to go online to pharmacy websites, and a residency requirement is not necessarily required to book an appointment. So it is true that people from neighboring communities could come to our pharmacies to get vaccine. We could book appointments in pharmacies outside of Haldimand and Norfolk.
It must be difficult then to give us an accurate amount as to how many of our 110 or so thousand residents have a vaccine. Or I'm looking at it when you give us the percentages that so many have been done, that's a percentage of Haldimand Norfolk. Is that the case?
Mr. Chair, through you to Councillor Corbett, yes, our stats for our clinics are Haldimand and Norfolk residents. So 31,000 vaccines have been administered to Haldimand Norfolk residents.
Thank you. So I see that as not an accurate amount as to the AstraZeneca that's been given in our community. So I would assume that additional people have been vaccinated over and
Yes.
above that figure.
Yes, Councillor Corbett, that would be true. 31,000 plus anyone who has gotten a vaccine at a pharmacy.
Thank you.
Heidi, I would just say, I know there's a lot of frustration right across the province on many different issues, but to reiterate what Councillor Corbett said, anybody that's gone to the Cuga site, I've heard very, very positive about how well it's organized, how smoothly it was ran, and very happy. So I just wanted to make that comment.
Thank you, Mr. Chair, and I will certainly pass all of this positive feedback on to our team. They have been working really hard, and we're very proud of the clinics. We've heard great feedback from all of the clinic sites, and we're really pleased to be working with our partners, Haldeman County staff, the Norfolk County staff, the paramedics in both counties, the firefighters in both counties, and the family health teams in both counties, and the family physicians. So we're really grateful for those partnerships and everyone working together.
Great. Hopefully by the end of May, we'll be in a lot better shape.
Fingers crossed.
Fingers crossed. Any other questions or comments for Heidi on her update? Then I'm going to move on to reports. And this one is under the Social Services and Housing Division. Staff report HSS 2105 regarding the Social Service Relief Fund Round 3 budget amendment on page 7. Heidi? Or
Mr. Chair, I'm going to pass it over to our Director of Social Services and Housing, Stephanie Rice, to present this report.
Great. Thank you.
Thank you, Heidi. Thank you, Mr. Chair. Through you to the committee. The Ministry of Municipal Affairs and Housing has allocated a third round of funding through the Social Services Relief Fund. The amount that was allocated to Haldeman and Norfolk counties is $1,577,867, 100% of which is provincially funded. The report is brought forward. We want to outline the areas that we propose to utilize the funds in. The decision that we have come to and the request that we're making is to utilize the funds in all allowable service categories. So those categories being the emergency shelter solutions. Under this category, one of the areas that we wanted to focus on is piloting a security guard at our emergency housing location in Jarvis. That decision was come to in response to members of the community and neighbors bringing forward some concerns, as well as allowing us to continue to ensure that people are complying with COVID regulations and participation requirements of the program. Also looking to increase our allocations for Housing Stability Bank through homeless prevention. Housing with related supports. One of the highlight points that I'd like to bring forward is our request to pilot a 1-year project with a community partner through an RFP process to help us more directly support those with mental health addictions crisis, particularly in the core downtown areas in both of our counties. And the fourth category being services and supports. So continuing to allow us to provide the food service program that we've been providing, cleaning supplies, personal protective equipment, and allowing us to have transportation available for those who require a vaccine when the vaccines become available, among some other pieces there. Because this funding came through after the budget was completed, we also need to request a budget amendment for the due to the funds that have come through to us. And that's it for my summary. So through you, Mr. Chair, I'd like to open it up to questions if there are any from the committee.
Okay, thank you, Stephanie, for your report. Are there any questions in regards to this report? Any comments? I think the idea of the security guard at the Jarvis location is a wonderful idea. Obviously, the problems that we've had there. Stephanie, I wanted to ask you a question regarding the shelter. If there's a necessity to go ahead with those extra beds, are we still talking about beds, bed allocations in our existing locations or new locations?
Thank you, Mr. Chair. At this time, the bed allocation is 17. We are not currently at full capacity with the beds, so we do have some additional room within those beds. If there were a need to go beyond that, we would have conversations and bring that forward as well. At this time, we would be looking at utilizing the existing location that we have. And as I said, it's not at capacity right now, so we do have some additional space.
Okay, thank you. Any other questions, comments? Then I'll look for a mover for the motion exactly as printed on page 10 of the agenda. Mover and seconder. Councillor Taylor's moved. Seconder. Councillor Corbett. All those in favor of the motion? It is carried unanimously.
Thank you.
Second report is on page 19, and it's in regards to the designation of administrator for the Ontario Works and Child Care.
Thank you, Mr. Chair. I will present this report. This is really a housekeeping report as positions have shifted within the division in order to be compliant with the Ontario Works Act and the Child Care and Early Years Act. We need a bylaw to appoint Stephanie Rice as the administrator for both Ontario Works and Child Care.
Any questions or comments on that report? Pretty straightforward. I have a mover for the motion on page 20 and 21 exactly as printed. Can I have a mover and seconder? Councillor Van Passen's moved. Councillor Patterson seconded. All those in favor of that motion? It is carried unanimously. Third staff report is on page 22. That's in regards to the social housing management plan, the request for sole source purchase on page 22.
Thank you, Mr. Chair. This is also me. So in the housing program, our housing providers use a software program called Asset Planner, and it is a program that we have procured through the Housing Services Corporation, which is a provincial organization that supports social housing across the province. This software program, our housing providers use it to keep track of their building condition assessments, their capital repairs. It supports them in doing asset planning and capital repair planning. Our agreement has come up for renewal, and we are being offered a new 5-year agreement with no price increase. And so these funds are already included in the social housing budget for 2021. However, in order to sign the service agreement for a 5-year service plan, we need to have an exemption to the purchasing policy so that we can do it as a sole source purchase.
Okay, thank you, Heidi. Are there any questions on this report for Heidi? I see no hands. The motion is on page 24, exactly as printed. Can I have a mover and seconder? Moved by Councillor Corbett, seconder. Please, Councillor Taylor. All those in favor of that motion? It is carried unanimously. That's the end of our staff reports. Communications on page 25, the Ontario Seniors Dental Care Program capital funding. That's just a memo. Are there any questions or comments in regards to that memo? Councillor Corbett, question?
I don't understand the 400,000 outstanding. Maybe we could have some indication of that. Is that covered by the money?
So, Mr. Chair, through you to Councillor Corbett, the issue in Simcoe is that the costing for the construction of the new dental suite is $400,000 more than the original budget. And so there is a request into the Ministry of Health under our one-time funding envelope in order to provide that additional 400,000 so that we can go ahead with the project. And the ministry has indicated that we can request additional funds, and so we have done so through our annual service plan through one-time funding.
Thank you.
Councillor Van Passen.
Yeah, I have a similar question. Just by reading the report, I don't understand whether we have spent $300,000 and got nothing, and we got to spend $400,000 more to get it, or is just the budget has gone up from 3 to 7 and we haven't spent anything yet.
So, Mr. Chair, through you to Councillor Van Passen, we have not done any construction. We haven't, we just got the quotes. So we have requested to carry previous funds forward, and we have requested additional funding. The issue is that with COVID-19, there are additional ventilation requirements and that sort of thing for dental suites. So that has increased the cost of construction on these types of rooms. So it's a combination of a carryover, a request to carry over, and additional funding.
Does that answer your question, Councillor Van Pass?
Yes, it does. And well, actually, the wife and I are doing a little renovating on a house, and pretty well all materials are double the price they were a year and a half ago. So this is expected. It's unfortunate. Don't like it, but that's the new rules of the game, right? So thanks,
Yep.
Heidi.
Thank you.
Yeah, I'm finding that out with the installation of a fence in my backyard too. Councillor Taylor.
Thank you, and through you. With the cost going up so much like this, is it a good opportunity to possibly open those conversations with the province up again about just partnering with someone in the community that's already established, that doesn't have to build anything? I feel like we could go a lot further if we're putting that $300,000 towards actually giving that money to dentists performing the work that needs to be done for these individuals. But I know last time we tried to have that conversation, the province basically just said, no, you got to hire someone. But I'm wondering with the costs increasing, if they've maybe thought about it. Don't know if that's happened yet or not.
Mr. Chair, through to Councillor Taylor, I'm not aware that we have revisited those conversations, but certainly should the funding not come through, and if we're not able to complete the construction with the funding that we have, then I think I agree that would be an opportune time to revisit that discussion.
Thank you.
Any other questions? Can I have a motion to accept the items listed as communications on page 25?
Mr. Chair?
Yeah.
I see Stu's hand went up there.
I'm sorry, Stu. Go ahead. Go ahead, Stu. I think, Stu.
Yeah. Thanks, Tony. I'm back to having my video problems. Thanks, Ryan, for pointing that out. Heidi, just along the same format as the three previous questions, I realize that the price of lumber and earrings went up. I'm going by memory, and I could be wrong, but in your new buildings on Robinson Street, like in Norfolk County buildings, were they not part of that not set up originally for a dentist facility? And I believe it's vacant. Is there any chance of looking at it could be a cost saving? I don't know. Like how far you've went ahead at Health and Social Services building. Is there any possibility of moving the building to somewhere that might be more cost efficient, such as your new offices on Norfolk Street, or is that even being considered, or is that out on left field?
So, Mr. Chair, through you to Councillor Patterson, I am aware that in the Robinson Street building, there were private dental practitioners in there. I don't know exactly what their office suite looked like because I've not ever been in it. But I think certainly that could be an option that we can look at for sure. Thank you for that suggestion.
Okay, so can I have a mover and seconder to adopt or accept the items listed as communications on page 25 as information? Mover, Councillor Taylor's move, seconder. Councillor Patterson, thank you. All those in favor? Motion is carried unanimously. Anything under other business? Heidi, I just have one question. The Lawson House in Hagersville, which I know you're familiar with, you and I have spoken before. Not too long ago, Haldeman Fire Department went in and did an inspection and found there were too many infractions, and the building was shut down. And I know the day it was shut down, our fire department was there, the OPP were there, staff from social, and it was not a very pleasant day. I've seen no activity at the building since, none whatsoever. My question to you is, I'm assuming that many of the tenants in that building may have been recipients of ODSP or Ontario Works. And I was just going to ask you, can anybody on staff tell me, I don't need an answer right now, but can anybody on staff email me and tell me what happened to those tenants? Did some end up in our emergency shelters? If you can answer that question now, fine. If you can't, an email is fine.
Yeah, no, Mr. Chair, I am aware that our homeless prevention staff were some of the staff that were on site that day helping people move out of that building. And we worked with the tenants to look at other housing options for them. And yes, I am also aware that there were at least some tenants that did not have alternate housing arrangements, and they were admitted to the emergency housing program. I don't know where they're at in their stay today, but once they become guests in the emergency housing program, then our housing support workers work with them to identify more permanent housing solutions. And there isn't an automatic 30 days anymore. So as long as people are working on their goals and as long as they're following the participation requirements of the program, then they might be in housing for 2 months or longer, because that's how long it takes to find more permanent housing these days. But that being said, our housing support workers are very connected to our staff in Ontario Works and to staff in the ODSP program. And so when people move into emergency housing, if they are recipients of OW or ODSP, we make sure that they are connected with their OW or ODSP workers so that their level of assistance can be adjusted accordingly. When they're in emergency housing, so we remember that there are two parts to a social assistance check, one for shelter costs and one for basic needs. When people come into emergency housing, their shelter costs are covered. So their check is adjusted because they don't have any shelter costs, but they still continue to get money for their basic needs. So that's where they can buy food, they can pay for, transportation to an appointment if they need it, if we're not able to provide it, that sort of thing. So we work with them to make sure that their OW or ODSP workers know where they are, and when they're ready to discharge themselves from emergency housing and into more permanent housing, then we help them again to reconnect with their OW or ODSP worker so that those shelter costs can be started up again if they're paying rent and utilities.
Okay. I appreciate that information. I guess the only comment I made to you in the bigger concern that I have is that this building was right in downtown Hagersville, used to be a former hotel. And my understanding from Haldeman County bylaw, Randy Charlton, is that the province will allow for these type of facilities to pop up anywhere in commercial and residential areas, unregulated by the province, unregulated by the municipality. My understanding is pretty much all the tenants in that building had some sort of mental health issue, and yet it took, nobody's going in to check, and yet it took an inspection by our fire department to shut it down, and now we, the municipality, are dealing with the fallout. I think that's a pretty poor system. And I'm not blaming the municipality, I'm blaming the province. I don't think that these facilities should be allowed just to pop up anywhere unless they're regulated and there's regular inspections inside these buildings. Somebody could have been hurt in that building. There could have been a fire in that building, and if Jason Gallagher hadn't gone through and did the inspection that he did, could have been one of our firefighters getting hurt in that building. Not to mention the aftermath and the traumatic that the tenants had, because I heard all about that. And I think we should be expressing our concern to the provincial government about what's happening here. Many people in the community ask me, how can these facilities just pop up? Aren't you, the municipality, watching them? The answer is no, we're not. Other than from a building and fire standpoint, and those inspections don't happen every week. So something to think about maybe for next meeting, is there a way we could get the two mayors to draft a letter and send off to the province? I understand that these, it's necessary for these folks to have a place to go, I get it, but somebody has to be regulating these facilities.
So, Mr. Chair, we would consider it to be a rooming house. So, not unlike a motel. If it is a multi-residential, it's a private multi-residential building, and so if it meets the zoning requirements, the bylaw requirements, the fire requirements, social services, rightly or wrongly, would not have a connection to it unless we were funding it as an emergency housing location or as a supportive housing location. And Lawson House is a location that has been one of those privately owned and operated rooming houses. I understand that the owner operators were advertising it as supportive housing. It is not listed in any legislation that governs supportive housing. It doesn't receive funding from the Ministry of Municipal Affairs and Housing. It doesn't receive funding from the Ministry of Health. It doesn't receive CHIPPY funding. And so none of those legislative requirements that are tied to CHIPPY funding or Ministry of Health funding or MMAH funding apply to it, because it's a private rooming house. I would equate it to the old Norfolk Inn in Simcoe. Mm-hmm. Similar kind of situation, right? That a private person owns it, they rent out rooms, they're able to maintain the operations based only on the rent that they get from the tenants. They're not asking anything from us, so we have no control over it. From a social services standpoint, our clients, they provide us with what's called a rent verification form that has the address, the landlord's name, and the amount of rent that they pay. Our staff verify that it is a residential address and that it's owned by the person that the client is saying that it's owned by, that they're paying rent to that person. Our staff don't do any sort of, I'm going to say, quality control checks over the housing. We don't have the legislative authority to do that. There's no framework within the Ontario Works Act or the ODSP Act to tell us, if you go out and do an inspection, here's your legislative checklist. If it meets 3 out of 5 of the yes, OW can pay the rent on this. If it's less than that, no, OW can't. We're just verifying that it is a residential address and that the landlord is who the client says the landlord is. Is that a gap? Yeah, it is a gap for sure.
Okay.
Because we know that we have clients who are living in housing that's either inadequate, unsafe, unaffordable. And so we're working with them on that life stabilization side, but we don't have our OW staff, our ODSP staff don't have any authority to go in and shut down a place like that. We would report it to bylaw, we would report it to fire.
I guess that's the gap that I'm worried about, because this one could have been a disaster. In the words of our fire chief, could have been a disaster.
Mm-hmm.
Anyhow, anything else under other business? Then I guess we're adjourned until May 17th. Thank you very much. Enjoy the rest of your day.
Thanks, everyone. Stay safe.
Take care.
Thank
Bye
you.
now.
Bye-bye.
Take care.